Tell me, if you would, about a time where your work was criticized. And tell me about your immediate reaction and then sort of how you overcame.
Hey, I can definitely think of several moments when my work was criticized. Um, the first thing that comes to mind was when I was working with a partner who was actually my preceptor at the time. I was still a paramedic student, and this partner already did not like me very much. And in this situation, he was the person precepting me. So I made the treatment plan as a student paramedic. I would say, okay, this is what I think we should do for the patient, and I usually err on the side of most cautious, using the most resources I have available, and sometimes using more things than a seasoned paramedic would, because I don't have that innate judgment when I'm a student. I don't just know, oh, okay, looking at these symptoms, I know what's going to happen. So I suggested we involve medical command, which is a resource EMS has to call a physician to say, hey, this is my treatment plan. What do you think? Especially if you think that it varies from your protocols, because we practice under the licensure of a doctor who has protocol set out. So anytime I encounter a patient that I think might be a little more dangerous for me to handle on my own, I like to seek medical command. And he laid into me afterwards for seeking medical command, saying, you should have just done it yourself. You would have been absolutely fine. And I will be honest, I was definitely disheartened at first because I didn't see anything wrong in what I did. But later, I just asked him, okay, in the future, if I'm confused on a patient, what would be the best way to remedy it if you don't think I should have called medical command? And he did lay out some guidelines and definitely some things that were actually pretty constructive. Even though at first I thought it came out of just a dislike for me, I saw that there was definitely an education component to it. And some of the advice he gave, I still use to this day when it comes to encountering patients that I don't immediately know what to do with. And yeah, so even though I was disappointed and a little disheartened and taken aback, I may or may not have cried. I was able to have a conversation with him a couple hours after the situation just to calm myself down and try and seek something good out of an encounter that normally would have just put a bad taste in my mouth.